Hello, I'm Jeremy Fernandez. Coming up, the virus claims more victims in Victoria, including a man in his 20s who's now the youngest Australian to have died from coronavirus. Plus, Russia's go-ahead for its new vaccine is slammed by health authorities all over the world. First, though, Victoria's case rate is falling, but officials there say stage 4 restrictions in Melbourne will stay for as long as there are hundreds of new cases each day. Yesterday, the state recorded its lowest single-day increase in more than 3 weeks, and the general downward trend over the past week is causing some optimism. However, 1 in every 5 cases in metropolitan Melbourne is from an unknown source, and that's mainly among people in their 20s. 659 Victorians are in hospital, but in a promising sign, authorities are now confident that Victoria has passed the peak in community transmission.
These are still the effects of mask wearing and stage 3 restrictions, so I think that's encouraging that we've turned the corner with those interventions and that we should see a further driving down of transmission with the stage 4 restrictions. So yeah, it's going in the right direction. I'm very confident we've seen the peak, but it's got to come down quickly.
One of the main worries in Victoria is the number of deaths. 289 people have succumbed to the virus there. That's double the number from just 2 weeks ago. On Wednesday, there were 21 deaths reported, a record number of victims in a 24-hour period in Australia. Nationally, 375 people have died since the outbreak began. A man in his 20s is among the recent victims. He's now the youngest Australian to have died from the virus. Most of the deaths have been in the aged care sector, which is reeling from Melbourne's second surge. This week, an inquiry heard that most aged care operators are still poorly prepared to manage outbreaks.
In my opinion, hundreds of residents are and will die prematurely because people have failed to act.
There's a document that allows the federal government to say we have a plan, but when you ask the question, is the plan sufficient? I'd say no.
The Prime Minister has meanwhile apologised for his government's failures, which have contributed to those deaths in aged care homes. Here's our National Affairs correspondent, Greg Jennett.
The sad truth is, some days we fall short.
Failure finds words in a sorrow that now speaks.
On those days that we fall short, we're sorry.
4 days have passed since Scott Morrison last spoke here.
Thank you all very much.
A silence filled by the damnation of a silk.
Tragically, not all that could be done was done.
Peter Rosen's QC unloaded at the Aged Care Royal Commission on preparations poorly planned.
We will be submitting that it was not well prepared. The sector is not properly prepared now.
And the Commonwealth, as regulator and funder-in-chief of aged care, has been smarting ever since.
A pretty damning indictment. Would you agree?
I would take issue with those comments.
Do you have an apology to offer to those families?
We have at every occasion expressed incredible sorrow. We are certainly not arrogant or show hubris.
The sad toll on the frail aged is by now well documented. More than 220 deaths nationally. The virus has penetrated close to 100 Victorian facilities. Well over 1,000 residents, staff and carers COVID infected.
We are learning as we go. It doesn't mean we haven't got a plan. We do have plans.
The Commonwealth's defence is plans and funding were in place, but the Victorian system was simply overrun, swamped by the scale of community transmissions from outside the gates of aged care homes to within.
Of course we're sorry about that. Of course we're devastated by it.
Apologising for tragic failure was probably inevitable. Symbolism is important. Talk is also cheap. The deep malaise affecting aged care, sadly being tallied in lives lost at present, will also be counted in the billions of dollars needed to fix it by the time the Royal Commission reports next year.
The increase in deaths and the stubbornly high infection numbers have prompted a major testing blitz in 3 major regional Victorian towns. Reporter Jess Davis has more.
There are now almost 500 active cases of coronavirus in regional Victoria, and while most of them are connected to known outbreaks, there is a rising number of mystery cases, which is what the real concern is, as we have known from this outbreak over the last few months. So they're going to be targeting 3 of the major towns outside of Melbourne. That's Bendigo, Geelong and Ballarat. Bendigo currently has 51 active cases, Geelong 172. Ballarat has less, it's only 24 active cases at the moment, but most of them have all been in the last 2 weeks, and there is concern about those mystery cases, as I mentioned before. They also mentioned yesterday, the Deputy Chief Health Officer, Alan Cheng, said that stage 4 isn't off the cards for regional Victoria. So over the coming days, depending on how this testing blitz goes, we may see some stricter enforcements coming into regional areas as well.
A third Catholic school in Sydney has been closed after a student there tested positive to coronavirus. That student is one of 10 new infections in New South Wales.
It's the human tragedy behind the statistics. Families mourning after a COVID-19 death.
Everyone who knew her was touched by her.
Jamili Joseph was farewelled at the Our Lady of Lebanon Cathedral in Harris Park, her local church, and the place where she caught the infection that killed her. Before her death, the 80-year-old had been in intensive care, with her family unable to visit.
Despite her passing away, also them not being able to have contact with her prior to her passing has been extremely distressful, extremely upsetting.
There remain 25 cases linked to the cathedral. New South Wales Health announced 10 new infections today. 5 are linked to local clusters, 2 are under investigation, and 3 are overseas travellers in hotel quarantine. Among the new infections are 2 more cases at Catholic high schools. One, a student from St Vincent's College in Potts Point. The other, another student from the Tangara School for Girls in Cherrybrook. Today's new case has brought the school's cluster to 21. As infections connected to the senior campus continue to spread, police were brought in to investigate whether there'd been any breaches to public health orders. This afternoon, they determined no rules had been broken. A number of new alerts have been issued for venues visited by infected people. They include the Dooley's Catholic Club in Lidcombe, the Cruising Yacht Club of Australia in Rushcutters Bay, and the Robin Webster Sports Centre in Tempe. All have been temporarily closed as cleaning and contact tracing is underway.
As community transmission of coronavirus continues in more populated parts of New South Wales, concern is growing about the potential for it to spread through regional areas there too. There are currently no restrictions on movement across the state, so some worried local businesses are taking matters into their own hands.
The beds are made and the towels laid out at this fishing lodge, but no one's coming. And that's just the way the owner wants it. Ron Guthrie has shut his doors to people from outside his local area, effectively closing the whole business.
We just took the view, we'll protect the local community and just close down.
This business is an offshoot of the family farm, and coronavirus joins drought, fires and floods on the list of setbacks over recent years.
What's the price you put on health? You know, you can't put a price on health.
The closure means a fishing charter that often takes his guests out is also short on work, but the operator is on board.
It's hard to draw the line somewhere where you want to work, but by carrying out the work and asking people to come, we're running a risk of, of extending the length of the virus, which could be even worse financially for everyone.
They're not the only ones. On the New South Wales south coast, this publican isn't letting people in if they're from Sydney or Victoria.
A lot of the sort of population around here are sort of elder sort of people, so yeah, we're sort of trying to look after our patrons as well as our staff and ourselves at the same time.
The latest available jobs data shows tourism was already being hit hard by the bushfires and early stages of COVID-19 in the March quarter. Operators are pinning their hopes on an industry recovery.
I'm probably getting a bit ahead of myself, but hopefully people will, can get through the pain, then they'll want to come out.
And the fish will be ready and waiting.
Inexcusable and unjustifiable failings behind the Ruby Princess coronavirus cluster have been laid bare in the findings of a special inquiry. The Commission's final report reveals 28 deaths have now been linked to the cruise ship, and the true number of infections may never be known. Much of the criticism has fallen on the New South Wales Health Department.
They signed up for a cruise. What they endured was a cluster. 5 months after the Ruby Princess's infamous journey, one of the most senior silks in the country delivered blistering findings. Brett Walker SC questioned why thousands of passengers were allowed to disembark before test results were known. At the risk of sounding crude, this is not rocket science. He said officials from New South Wales Health failed to do their jobs. The decision to assess the risk as low risk, meaning in effect do nothing, is as inexplicable as it is unjustifiable. It was a serious mistake. The report reveals 28 deaths are now linked to the ship, while 663 Australian passengers and 191 crew members contracted coronavirus. Fred Jackson and his wife Julie spent weeks apart in separate hospitals after testing positive.
There is a lot of people have got to be held to account on this because lives have been disruptive.
A week into its voyage, the ship docked in Wellington and 5 swabs came back negative for COVID-19. There were just 25 swabs on board. Mr. Walker called that a woeful shortcoming. The ship's doctor suspected an influenza outbreak. Carnival cut the cruise short to return to Sydney. The day before the ship docked in Sydney, an illness log sent to the health department recorded more than 100 people with respiratory symptoms. Still, the ship was deemed low risk. But sick passengers continued to come forward, and the report found New South Wales Health missed the significant spike that was developing. The Health Department also failed to use updated national guidelines on what constituted a suspected COVID case. Mr. Walker found everyone with symptoms should have been tested. The ship arrived at Circular Quay and 2,700 passengers disembarked despite the pending results of 13 COVID swabs. The first positive results were delayed until the next day, by which time passengers were long gone. That delay was slammed as inexcusable. A criminal investigation by New South Wales Police is ongoing, and the findings are expected later this year.
Nationally, the rise and fall of daily coronavirus cases largely tells the story of what's happening in Victoria because it accounts for the vast majority of cases. There have been more than 16,000 infections confirmed in Australia since the 1st of June. 15,300 have been in Victoria. There have been 680 in New South Wales. The Chief Medical Officer is warning that the effects of the virus will linger long after the numbers come down and the lockdowns are lifted.
It's very difficult, the situation that people are in now in lockdown. That does take a toll. The things you mentioned, mental health, domestic violence, all of those things are of concern, absolutely, and we need to have a balance there, as well as with the economic disruption. That's why we've always gone for our suppression strategy rather than an elimination one.
Now to one of the big shocks of the week, the re-emergence of the virus in New Zealand. About 10 new cases have been recorded each day for the past 3 days, with 30 cases of community transmission in total. The country had been widely praised for its response to the first wave of the outbreak, racking up 100 COVID-free days. But now major population centres, including Auckland, are back in lockdown, and authorities there are bracing for more infections to pop up.
What we have seen and what we will expect to see is because this is a cluster and we've seen this earlier in the year, the numbers will grow out, and what we will be looking to do is see that the additional numbers are stabilising over the next few days. But again, pointing out what we're wanting to do is find all these cases. That's why we're going so hard on very wide testing around any new cases.
One of the New Zealand government's key advisors during this pandemic has been Professor Michael Baker, an epidemiologist at the University of Otago in Wellington. He says the government was justified in pursuing its original strategy of elimination.
The essence of the elimination approach is that you have this goal and you use all of the tools we have available, and the evidence is that countries pursuing this are doing very well from a health and economic perspective. I mean, New Zealand now has the lowest COVID mortality in the OECD, and our economy was really thriving under elimination over the last few months. And so we're very keen to get back there, and we're very confident that we can. But I think it's interesting to look at the other countries in the region that are pursuing elimination. And Taiwan, of course, has gone for longer than New Zealand did with no outbreaks. The same, interestingly, for Mongolia. Fiji has also eliminated the virus, and these countries are doing well. But really, one of the most remarkable examples, of course, is mainland China, which has largely eliminated transmission of this virus. They get the odd outbreak, but they're protecting 1.4 billion people. Their economy has grown from same time last year, and Vietnam is also experiencing very good economic growth. They have had another outbreak in Da Nang, which they're bringing under control at present. And there are a number of other countries in the region heading down the same path. And of course, you only have to look at most of Australia, which is doing very well with elimination. So I would say, compared with countries pursuing suppression, which is most of Europe and North America, the evidence is very compelling for heading down the elimination path. And I think New Zealand demonstrates one aspect of this, and that is that elimination doesn't mean the virus is gone forever. It means that you aim to eliminate community transmission, and you obviously organise all your systems to achieve that, but you also accept that you will have setbacks, and just to plan for those and to make them as manageable as possible.
Professor Michael Baker there. Though the major outbreaks elsewhere in the world are still growing. More than 20 million cases have been confirmed and more than 750,000 people have died globally. More than a quarter of those have been in the United States, and the number of infections in Brazil and India is also continuing to grow. You can see here how many cases those countries are adding each day. India is still near its record peak of about 60,000 new cases a day. The US is trending downwards, however, with the figures hovering around 50,000 a day. Health authorities there say they are still in the thick of this outbreak. The World Health Organization says Beirut is experiencing a surge in coronavirus cases, with healthcare services knocked out by the deadly explosion 10 days ago. New pictures have emerged of the blast ripping through the city's oldest hospital. It was less than 2 kilometres from the centre of the explosion at Beirut's port. Patients and staff can be seen running for cover as the shockwave struck. The WHO says it's worried the scale of the emergency is sidelining protective measures against coronavirus.
Communities now have other priorities. Perhaps there's a little bit of COVID fatigue, and we have to re-engage them very strongly to make sure that the COVID response remains a priority for them.
Lebanon has had thousands of coronavirus cases recorded since the explosion. Global health experts say there's not enough scientific data on the COVID-19 vaccine that Russia has approved for widespread use. Only 2 months of human trials have taken place, far short of the usual testing standards applied to vaccines.
A diseased planet saved by Russian technology. That's how Moscow wants its world-first COVID-19 vaccine to be known. Russia only began human trials of its vaccine in mid-June, but Vladimir Putin says it's ready for mass production and he's tested it on his own family.
One of my daughters has been vaccinated. In this sense, she has taken part in the experiment.
Russia's Sovereign Wealth Fund says 20 countries have already placed orders for more than 1 billion doses.
And we now have production capability of 500 million vaccines that can be produced in the next 12 months.
But stage 3 trials, where a broad section of the community is tested for side effects, are yet to take place.
And we expect clinical trials to start in UAE, Saudi Arabia, Philippines very soon.
Not everyone is convinced.
I hope that the Russians have actually definitively proven that the vaccine is safe and effective. I seriously doubt that they've done that.
If you miss out some of the bigger clinical trials, then you won't necessarily have that data to be sure that a vaccine is either effective or safe.
Unlike other major research groups around the world, the Moscow Institute behind this vaccine has yet to release any of its safety or immunity data, making independent verification of its efficacy virtually impossible. Russia plans to roll out the drug from next January. But the World Health Organization said it will only accredit the vaccine after exhaustive analysis of its effectiveness and safety.
That's the latest on the virus. Thanks for joining us. You can stay up to date with the latest coronavirus headlines on the special coverage page of the ABC News website. That's abc.net.au/coronavirus. We'll be back next week. Bye for now.